You just found out you got cancer. You're going in, your world's kind of crumbling around you. You don't know what's going on. You can't find your car keys. You don't know the names of your kids because you're so nervous about all of this. And you go in, and a doc starts talking to you about, chemotherapy and choices and all of that stuff, and side effects. And you're hearing some of it, and you're not hearing other. And we know we give a lot of information. We hand you some pamphlets and send you out to make a decision. You need to know as a patient that that's important. You need to get the information. So if you're browning out, if you're distracted, if you didn't really understand, we want you to understand. Yes, we're busy, but we care about you. So if you need to grab us and tell us, no, you can't go yet because I didn't get that, or I need a follow-up visit to further explore that, that's fine. We get that because it's complicated. We have other folks within our groups who help us. So we might give the opening presentation, but maybe a resident or a nurse or one of our other teams would come in and help describe some of the other factors that go along with it. So recognizing that it's not just one person and that's it. You're going to get multiple versions of this and multiple chances to ask questions and get answers. The other piece is, particularly for patients undergoing treatment, it's a long-term relationship. And so you really want you and your oncologist to communicate long-term. Bluntly, it may be either till cure or, I'm sorry, until death do you part. And so if you thought about that from an early stage, that actually this doc's going to be taking care of me for the rest of my life, you want that relationship to be positive and strong. And so we docs feed off of our patients. You are our energy. You're why we get up in the morning. And partner patients are fabulous. We don't mind you being a nudge. We don't mind you asking questions. As long as you recognize that we're trying hard, we're busy, and yeah, we'll keep you waiting 30 minutes sometimes, and sometimes we'll be right on time. We're human, but we are trying and we care. And so the energy that you have back and forth with your oncologist is often magical, often disruptive, and you can see when that's not going well, know that there is better out there. It may be just a personality thing. It may be just a switch, or some other member of their practice, or coming out and saying, we don't seem to be communicating well. So know that that's a very personal, very intimate relationship. It matters. The better that relationship is, I think the better your care is, the better you feel about how you're doing.